I want to welcome all of our guests. If you're a guest on the line, please put in the chat that you're a guest and let me know who invited you. I also want to welcome all of our business partners who show up each and every Wednesday night to get nuggets, to get information about how to utilize our Wakana products in so many different arenas. So tonight, I'm going to talk about CBD Cannabidiol and fertility. And so I was laughing because when I put the post up, a lot of my friends who are postmenopausal made some comments on our Facebook page that their eggs are all dried up. And that's okay, because many of us who are postmenopausal or menopausal or even perimenopausal have loved ones, have children, maybe nieces who have issues with fertility. So we want you to take this information back, as well as the recording, to anyone that you know that is dealing with issues with their fertility. So what is fertility? Well, let me first introduce myself. I'm Dr. Rita McGuire, the Chief Medical Officer, one of the four co-founders here at Wakana. And I'm excited to meet all of you. Many of you I know, but there are some new distributors as well as guests on the line. So welcome, welcome, welcome. So fertility, what's fertility? Well, fertility is really the ability of a woman to conceive children. And as we age, of course, this diminishes over time. There are some natural, holistic options for women who want to improve their fertility. And as an OB/GYN physician of over 30 years, you know, there are thousands of women that I've treated over the past 30 years that deal with infertility, or they deal with recurrent miscarriages where they can get pregnant, but they can't sustain the pregnancy, and they typically have a miscarriage within the first trimester. So when we talk about fertility, yes, we're talking about the female reproductive tract. There's something called male infertility, but we're not going to talk about the men today. We're going to only concentrate on the women. And women, we have our reproductive organs, our uterus, our ovaries, our fallopian tubes, but it's really up to the ovaries to be sufficient in producing enough estrogen. It's up to the ovaries to produce quality eggs to really achieve a healthy pregnancy. There are some natural fertility boosters. You know, there's lifestyle habits. I can't stress that enough. Proper diet, exercise, rest, hydration, reduction of stress, herbal medicine, alternative therapies, which we're going to talk about today, which are CBD, which absolutely can be used as options for infertility. There are other factors that influence fertility. Congenital and hormonal disorders, anywhere from diabetes to polycystic ovarian disease, to thyroid issues, to obesity, to metabolic syndrome, to lupus, fibromyalgia. A lot of these long-term congenital as well as hormonal disorders can affect a woman's ability to get pregnant. We talked about lifestyle, you know, a lifestyle full of processed food, a lot of meat, red meat, a lot of fried food, fast food, all of those lifestyle that really doesn't promote a healthy environment for fertility to occur. Environmental hazards, pesticides, pollutions. You know, we can't get away from the air we're breathing, but we can look at some of the products that we're using. Deodorants, lotions, shampoos. Are we dyeing our hair? All of these factors, as well as environmental, come into play. Our psychological state, oh my gosh, the stress, the anxiety, mood disorders, mental conditions, schizophrenia, bipolar, all of these come into play when we talk about fertility as well. And then sexually transmitted diseases and infections, past history of chlamydia, gonorrhea. These infections cause scarring of the fallopian tube in a woman, and it will reduce the risk, it will reduce the chance of a woman getting pregnant. It reduces the chance of the sperm being able to get into fertilize the egg. So past sexual transmitted infections and diseases. So let's look at the cycle of both the ovary and the uterus. And this is really important to get a fundamental understanding, because when you're recommending CBD to a woman that has fertility issues, really for that woman to get optimal results, you want to recommend that they utilize CBD during the follicular phase of their menstrual cycle. You want to recommend CBD during the follicular phase, during the phase where you want to promote higher levels of estrogen. You want to promote that ovary to be as successful as possible. So the ovary has what we call a pre-ovulation phase before the egg is released, and it has a post-ovulation phase, and that is after the egg is released. And if the egg does not successfully get fertilized during the ovulation phase, then a pregnancy doesn't occur. And that's why you want to recommend the CBD products during this follicular phase. And we're going to talk about how you figure that out. The uterine cycle also is important because the uterine cycle has the period. When a woman menstruates and has a period, that's when the lining of the uterus is proliferative. It starts to build up. Then a woman ovulates, and after her period is the secretory phase, when the shedding of the lining of the uterus occurs. So these are some schematics of where you see the uterine phase. First, a woman has her period. Most women have their period for 7 days, and then they go into the proliferative and secretory phase of the uterus. But this is what we want to concentrate on tonight. When do you offer CBD to a woman that's dealing with fertility issues? You want to make sure that they're utilizing the CBD products that we're going to talk about during this phase here, during the follicular phase. So for women, many women who are trying to get pregnant, they understand how to count out the days before they have ovulation. If a woman has a regular cycle, if she has a 28-day cycle, typically on day 14, she's going to ovulate. So we want to utilize the CBD products a day before she's going to start her period, all the way up to a day before day 14. So that's day 1 through day 12 or 13. Now, the reason why it's so important to utilize the CBD product during the follicular phase is many reasons. One, some women have cramps. They have menstrual cramps. So you can offer the CBD products to reduce their menstrual cramps, to reduce the usage of Motrin and Aleve and Midol and ibuprofen. In addition, you're helping the follicular phase, you're helping that ovary that may have a reduction in estrogen production. And we're going to talk about an endocannabinoid called Anandamide. You're actually addressing a lot of different factors for a woman, not only to be in less pain during her period, but to increase the chances of ovulation to be successful. And then 3, reducing anxiety and stress that many women who are dealing with fertility issues go through. So you're killing like 3 or 4 birds with one stone with these CBD products when you offer them during the follicular phase of a woman's ovarian cycle. Okay, so that may be a lot, but it's not a lot. Just utilizing CBD during the first day of her period all the way up to a day before that 14th day, so day 1 through 13, is a good way of utilizing our CBD products. So traditionally, what do we have in medicine? Well, we have a lot of medicine to help women to become more fertile, and they come with a lot of side effects, honestly. We have pills. Clomid is one of the more popular medications we as OB-GYNs use to help patients with infertility. There are injections, gonadotropin releasing hormone. Success rate is only between 23 and 32%. But the risks and side effects are many. You know, one risk is having higher risk of multiple pregnancies, triplets, quads, you know, just multiple pregnancies can occur when you utilize fertility medications. You can overstimulate the ovaries. This can be a medical emergency where you have ovarian hyperstimulation syndrome, where the ovaries cause a shock. It's like a toxic shock to a woman. This can be very serious. And then ectopic pregnancy. A lot of these fertility medications can cause a pregnancy not to occur where it should, which is in the uterus, in the womb. It can occur outside of the uterus, in the tube. It can rupture. A woman can die from an ectopic or ruptured ectopic pregnancy. And then you've got to look at the cost. It's not cheap. It can go upwards of $6,000 per cycle of these medications. So having an alternative, having an option for women who are dealing with fertility is really important. So we're going to talk about that option, and that option is cannabis, CBD, cannabidiol. And cannabidiol is an amazing compound that comes from the cannabis plant. You know, the cannabis plant has 2 species. One species is marijuana. It's a species that gives you the high, the euphoria, the paranoia. And the other is hemp. Hemp is a species from the cannabis plant that has very low levels of delta-9 THC, delta-9 tetrahydrocannabinol, and very, very low levels of delta-9 tetrahydrocannabinol and higher levels of CBD or cannabidiol. So tonight we're going to be talking about our Wakana products, which are sourced from the hemp species. So it's a great option for those women who want to give the opportunity of the ovary to do some things that it should do to promote fertility. So hemp, again, is legal in all 50 states. In fact, in the 2018 Farm Bill, it was removed from being a Schedule I drug. It is legal to consume, to cultivate, and even to sell. And so it is safe and effective. And again, it is a substance, cannabidiol, that's very, very effective in creating and restoring balance. It restore balance in the body, specifically in the reproductive tract, the endocrine, and even the neurological systems of the body. So there are many, many benefits to CBD. In fact, there are 20,000 peer-reviewed articles. When we look at the research, we look at the data, we look at the science, how CBD, cannabidiol, and the other cannabinoids or compounds that the plant makes has been very effective on a cellular level to help to reduce inflammation. It helps to reduce pain. We're going to talk about how it helps to improve ovulation and how it also helps to improve mood. Because again, when you're dealing with couples, when you're dealing with women who have a long-term or even a short-term history of not being able to get pregnant, it's very stress-inducing. there can be depression, there can be a lot of anxiety that surrounds all of this. So there's other cannabinoids like CBG, CBC, Delta 8. These other cannabinoids also, along with CBD, work synergistically to really help the body to get into balance and really helps to promote some of the concerns and issues women have with painful menstruation, with anxiety, with improving the ovarian reserve and helping to increase estrogen and to really help to improve what we're going to talk about, one of the endogenous cannabinoids, anandamide. So this is the science behind how cannabis works in the body. It's called the endocannabinoid system. And this science, along with the other science, I'm really hitting you guys hard with science tonight, but no worries, I'll make it super simple at the end of really what to offer these women. But the science we first learned about the ovary, right? But the second science is the endocannabinoid system, because this system we all possess. And this system is made up of receptors in the body, throughout the reproductive tract, throughout the uterus, the ovaries, the tubes, the heart, the lungs, the liver, the kidneys, the bowel, the teeth, every single organ and gland, major organ and glands, and some of the minor ones have receptors, CB1 and CB2, that are looking for cannabis. So when a woman who is dealing with fertility issues, when she consumes CBD, these receptors are then activated to keep the body, to keep the reproductive organs, to keep the enzymes that we're going to talk about that can reduce fertility from happening. So this is a very important scientific phenomenon that has been discovered in the early 1990s, but absolutely for decades, these receptors and these cannabinoids have been known to work. So this is another schematic that just shows you that these receptors are in major organs and glands. And you can see one of the organs that we're talking about today, and that's the reproductive organs, the uterus, the ovaries, and the fallopian tube. So let's talk about our body, because our body produces endogenous cannabinoids. Yeah, our body produces compounds just like the plant, and they are called anandamide and 2-AG, and you can see them right over here. So the endocannabinoid system is regulating, modulating these receptors that we talked about. And there are many more receptors. It's just not CB1 and CB2. You can see there's a long list of other receptors that we don't normally talk about, but just know that they're there. There are also enzymes that the endocannabinoid system is regulating and modulating. And those enzymes are listed here. But the enzyme we're going to talk about as it relates to fertility is FAAH. So we're going to take a moment to talk about anandamide. Anandamide is a Sanskrit word that means bliss. Ananda means bliss. So anandamide not only makes us feel blissful, feel joyful, but anandamide is important in implantation. It is very important for anandamide to be in sufficient levels so when the sperm meets the egg and a union happens, that embryo can implant in that uterus successfully. So that is a successful process. So yes, the endocannabinoid of interest tonight is anandamide, and it's analogous to THC because it is the molecule of bliss. It makes us feel good. It does react and attach to CB1 receptor to put the reproductive tract into balance. So anandamide and CB1 receptors go together. So here is a great diagram of what we're talking about. This is the ovary. This is the part of the female reproductive tract that is important in releasing follicles during the follicular stage of a woman's menstrual cycle. This is the stage where you want that woman to utilize our CBD products. And you can see here that there is a balance between this enzyme FAAH and FAAH during different times of the transportation of that fertilized egg going to implant in the uterus, okay? So when we talk about the endocannabinoid system, we talk about how CBD and the endocannabinoid system is put into balance. So we need this very, very delicate balance or homeostasis to happen so a woman can get pregnant. So this is another diagram. Again, it's showing that when you have low levels of anandamide, you have high areas of FAAH, that's that enzyme. But when you have high levels of anandamide, you have low levels of that enzyme. And so in order for implantation, this is that embryo implanting in the lining of the uterus. In order for that to happen, we want high levels of anandamide around and low levels of the FAAH. Now, I don't know if many of you are out there, you played Pac-Man, right? That little thing that would eat up. Well, think of this enzyme FAAH eating up anandamide. Now, if this little sucker is successful in eating up all a woman's anandamide, she's going to have a very, very difficult time getting pregnant. And if she gets pregnant, she may have a difficult time in maintaining the pregnancy. She may miscarriage. And so this is where CBD comes in. When a woman consumes CBD, when she takes CBD, it actually blocks this little Pac-Man, this little FAAH from eating up all of her anandamide. So hopefully that makes it simple for you to understand is that we need anandamide, we need that endogenous cannabinoid around so a woman can be fertile, so a woman can have a successful implantation in the uterus and a successful pregnancy. So we have to do that by reducing FAAH. We have to reduce that enzyme from eating up all the anandamide. So when we have a reduction in endogenous cannabinoids, when we have a reduction in anandamide, we have a reduction in 2-AG, these are some of the things that can happen to a person, right? I know we're talking about fertility tonight, but a reduction in anandamide and 2-AG can cause some of these symptoms: migraines, fibromyalgia, irritable bowel syndrome, phantom limb pain, infantile colic, glaucoma, dysmenorrhea, which is painful periods, hyperemesis gravidarum, that's nausea and vomiting, excessive in pregnancy, unexplained fetal wastage, multiple miscarriages, PTSD, and bipolar disease. So that's why when we have a reduction in our endogenous cannabinoids, just like if we have a deficiency of potassium in our body, right? We eat more bananas. If we have a deficiency in cannabinoids, we need to consume more cannabis. We need to consume more CBD. So when a woman has fertility issues, it's recommended that she utilizes CBD during the follicular phase. During the phase where that follicle, that ovary needs help to improve estrogen levels, it needs help to increase anandamide levels, and then you can also help a woman if she has painful periods and cramps, or if she has heavy bleeding, or she has insomnia and anxiety due to this infertility. So you, again, with one CBD product or CBD products, you know, I never like to recommend just one CBD product, but CBD products can really address so many symptoms that this woman may be having. When we talk about depression and anxiety, because infertility causes a lot of stress and anxiety, CBD, when it's ingested, can help to improve not only anandamide levels that we talked about, but it can improve dopamine and serotonin, to release more serotonin and dopamine. These are two neurotransmitters that will help the woman sleep better, will help her mood, will address pain, and just improve her overall behavior. So yes, CBD can really be effective with anxiety and depression. So I don't have my disclaimer here, so I'm going to read it, that the FDA has not approved any of these statements. If you're under a doctor's care, if you're on fertility medications, yes, you can take CBD, but just consult with your physician before utilizing these products. Our products are utilized in several manners. I'm going to talk about 3 ways of using CBD in women who have fertility issues, and that is with our tinctures, that's with our edibles, our gummies, and that is with our topicals. Those are 3 products that you can utilize during the follicular phase of women who have fertility issues. So tinctures are oils that are placed underneath the tongue. We have a line of our power products. Those are our full spectrum products. They give you the legal limit of THC, which is 0.3% or less. And this is great because if a woman is, on her period, if a woman is not undergoing any random drug screens, yes, a power product would be very safe and effective for that woman. The power product tinctures come in 2 potencies. We have a hemp MD, which is our most potent product, 900 milligrams of CBD, and our hempradium 500 milligrams. Start low and go slow. 3 drops underneath the tongue twice a day is a great starting method during the follicular phase of a woman's ovarian cycle. We also have a broad spectrum product. That's our pure product. It contains less than 0.0% of THC. Start low and go slow. 3 drops twice a day. It's a great product for those who undergo random drug screens. We also have our water soluble. That woman may want to just put it in her water, her juice, her tea, anything liquid. 3 drops twice a day is a great starting dose. And then there are our edibles, our gummies. Our gummies come in our full spectrum. Those are our power products, and the black label, and the pure, which is our broad spectrum, and the white label. These are products that that woman can take to address insomnia, to address menstrual cramps, to address inflammation. These can be taken during the day or at night, but just know that edibles take about 30 minutes to an hour to get into the bloodstream because they have to go through the stomach, the liver before they get there to start to take an effect. Start low and go slow. Start with half a gummy first. And again, if a woman has random drug screens, you want to use our pure products, our broad spectrum products. And then our topicals. Our topicals also can be used by women who are having issues with fertility. This always happens to me, guys, where my battery is low. The topical products can be utilized for menstrual cramps, for dysmenorrhea, for a lot of times at the beginning of that follicular phase where they need that relief from pain and inflammation. So I recommend our Power Extreme Pain Cream and our Dr. Rita's Rub. These are 2 great products. Give me 1 second to plug this up. These are 2 great products that can be utilized very effectively on the abdomen to reduce cramps, to reduce dysmenorrhea, and to reduce a lot of inflammation and pain. You can utilize it throughout the day. You can utilize it at night. But these two products offer local relief for those women. Now, CBD can interact with medications. And the research that I've seen and have done so far, I don't see any interactions with any of the fertility medications like Clomid or HCG. But again, because CBD is metabolized in the liver, you just want to talk to the infertility specialist or your physician before utilizing CBD. But my research has shown that the fertility medications, there are no drug-drug interactions that can occur with CBD. So to sum it up, we want to offer the tincture, we want to offer the gummies, and we want to offer the topicals. The best time to offer the CBD products for women specifically who are dealing with fertility issues is when? Is during this follicular phase. So it's super easy. You just let the woman know that on the very first day of her period, she's going to utilize the tincture, the gummies, and if she needs the topical to reduce her menstrual pain, she's going to utilize these products from day 1 of her menstrual cycle all the way up to day 12 or 13, because at day 14 is when she's going to ovulate. Now, what is the CBD going to do as a recap? Well, it's going to increase the anandamide. Anandamide deficiency has been shown to reduce the effectiveness of ovulation. It's going to improve the estrogen level. It's also going to reduce pain if she has menstrual cycle. It's going to help to reduce anxiety, and it's also going to improve sleep. Because again, women, couples who are dealing with fertility or infertility have a lot of stress. They have a lot of anxiety. Sometimes they can't sleep, but these products absolutely, yes, can be a viable option for those women who are dealing with fertility or infertility. So I want to thank you for tuning in tonight. I'm going to take a couple of questions. If we can limit the questions to fertility, I do know on these calls, we will have millions of questions about things that are not the topic at hand. But if you have specific questions about fertility or the recommended dosing, again, it's during the follicular phase, we can take those questions at this time in the chat. And then after that, we can take some outside questions. Monique White said, I used CBD while I was pregnant, so yes, it works. Thank you, Monique White. Thank you so much. If there's any other testimonials, you can absolutely put them here. Oh, wonderful. Monique White is a guest of Mrs. Erica Zachary, who is another member of our medical advisory board. We have Tatiana Little, who is also a guest of Tavares. Thank you for joining. I love, love, love when we have a guest on the line. I love you distributors too, my business partners, but absolutely love when we have our guests. This recording will be available so you can share this with women who you know that are trying to get pregnant or have difficulty in getting pregnant, or women, like I said, who have had multiple miscarriages, okay? Oh, Monique is a new distributor. Well, thank you, Erica. Thank you, wonderful. Welcome, Monique, to our Wakana family as a new distributor. Thank you so much. No, Elizabeth Ann Thompson, it doesn't matter if it's pure or power. If a woman that has fertility issues has random drug screens at her place of work, at her job, then you absolutely can recommend the pure. Hey, Dr. Betty.
Hey, how's everybody?
We are doing great.
That was a great presentation. I learned a lot myself. But two things that I wanted to bring out. Number one,
Can you talk a little louder? For
okay,
some reason, I can't hear you as
I'm
clear.
multitasking. I'm in the grocery store. I'm at
Okay,
Whole
now I can hear you,
Foods.
Faith. When you get
Okay,
closer, I
good.
can hear you.
Okay, so one thing I want to say is since we're talking about fertility and giving birth, let's watch our language. We don't want to kill anything. So you said we kill three birds with one stone. I always say we can breathe life into two or three birds with one breath. How about that?
I love it. I love it.
Okay. And so then the other thing is when we're talking about fertility, I think a very, very important part of cultivating and preparing the body for that very, very important task is cleansing and regulating or resetting. That's the word I'm looking for. Resetting the body, and so for anyone planning pregnancy, which it should really be planned, I would like to encourage those people to look at our 21-day raw cleanse because I know of a number of people who have cleansed or detoxed that were having difficulty conceiving, and after the detox or cleanse, they indeed did conceive. So when we clean out the muck and the garbage from our system, it allows and replace with nutrient dense foods, then the body has optimal raw materials to re to develop new cells and tissues, and so it's a reset. So some of those areas where we have some dysfunction, uh, even in terms of the amount of anandamide that is produced, anandamide and 2-AG that are produced in the body, and enzymes. In addition to that, with the reset, you now get a more fluid and more optimal production of those cannabinoids. Okay, so that was my take on what was presented, and hopefully that helps somebody.
Thank you so much, Dr. Betty. I always love when you chime in and you give us nuggets and you weigh in on our conversation. Super, super appreciative. Erica Zachary is out here. How are you this evening?
Hey, Dr. Rita, I am wonderful. How are you today?
I'm great, thanks.
And as usual, it was an amazing presentation. I was just going to comment on what Dr. Betty just said, because I have two people that I know. One is my mom. I don't think she's on. My mom is a distributor. I'm not sure if she's on here today, but she actually has a testimony about me and my brother are 20 years apart because she adopted a vegan lifestyle. When they told her she could not have kids again, guess what happened?
She had a baby, yes.
So that was one. And then I have another MSer in my life. She's my sister friend. She actually did a plant-based lifestyle. She started probably a couple years ago, and she has a plant-based baby. So yeah, so if you want to unclog those tubes and get that anandamide going, yeah, adopt the plant-based lifestyle.
I love it. I love it.
Yes, yes, yes.
Recommendation, there's a question on the screen. Someone going through in vitro fertilization, same recommendation, utilizing the CBD products during the follicular phase. But absolutely when they are dealing with infertility specialists, please have them talk to their infertility specialist before starting the products. But this is absolutely a great way that you can introduce our amazing CBD products to women who are having issues, who want a holistic way of addressing their infertility, and that is with CBD. So again, if they're working with an infertility specialist, if they're on Clomid, if they're going through cycles of in vitro, please have them speak to their physician first. Great, great, great questions. So Stephanie, hopefully that answered your question. Do you have recommendations for someone on hormone therapy or artificial insemination? Same thing, yes. Elizabeth Ann Thompson says fetal creation and development. And I think your question was pertaining to pure versus power, right? Pure, it doesn't matter if a woman who is undergoing drug screens, at their job, you want to use the pure. And let's see if there's any questions in the Q&A. And there are no questions in the Q&A. Wonderful. So I'm going to close it here. You know, each and every Wednesday I'm on call, so I'm going to get upstairs to our patients. If you are a guest, you're on the line, I want you to connect with the person that invited you. You may be on the line and don't have issues with fertility, but you have other issues that our products can assist you with. You want to connect with the person that invited you. If you're on the line and you're like, oh my God, I know this person, and this woman dealing with fertility issues, get the recording and share it with them so that we can help them and assist them with our products, our CBD products that can help as well. Another tool, as I call it, in the toolbox to assist with their symptoms. So with that being said, thank you, Dr. Betty. Thank you, Erica. Always here, always supporting this call, always weighing in, always giving us nuggets. I thank our distributors, I thank our guests for joining us. We'll see you next Wednesday, 8 p.m. Central Standard. Get your guests on the line. Be well, be safe, and we will see you soon.
Good night.
Good night.